Hello, everyone. Thanks for joining us on the briefing for this afternoon. We'll go ahead and get started. We've got Dr. Moreno with us, who's going to give us some information about COVID-19. Dr. Moreno, do you have an update for us, or are you ready for questions?
Hi, Mia. Good afternoon. No update, but I can take questions from the media about COVID.
Great. So I've got some questions already submitted, and any of you who have additional questions, please go ahead and feel free to put them in the chat. So we'll go ahead and get started. A lot of our questions are about the new variant today. Dr. Moreno, could you give an overview of what is known about the COVID-19 Omicron variant at this point?
Sure. I'll do my best. This is one of many variants that have been detected during this pandemic. This one was identified as having multiple mutations, which was brought to the attention of the World Health Organization, and the World Health Organization determined that it met criteria for to be considered a variant of concern, and was assigned the name Omicron. What we know from the World Health Organization website is that it appears that the early evidence shows that this variant may be pose increased risk for reinfection among the population. We also know that it's primarily been identified in South Africa, and the United States also has some concerns about this as well. And that's about all we know at this time. We don't know whether or not we haven't read any reports as to whether this variant is more virulent than previous strains, meaning we don't know that it causes more serious illness. We don't know that it causes more fatality, more deaths than other variants at this time. And we don't know whether it will result in decrease in efficiency of testing, or decrease in efficiency of vaccinations, or decrease in efficiency of therapeutics treatments for it. So that will be information that we may be receiving later that would be able to better describe this new variant and its potential impact here in Monterey County in the United States.
Thank you, Dr. Moreno. Another question: what steps is the county taking to prepare for the arrival of the Omicron variant?
So it's very, regardless of the variant that have predominated during this pandemic, we continue to recommend that people in Monterey County take steps to reduce the transmission of COVID-19. And we made those recommendations with the original original strain. We've made the recommendations with the West Coast variant, the Delta variant, and we'll continue to make these recommendations now that Omicron has been detected here in California. And that is to get vaccinated, and if you're fully vaccinated, get a booster shot when you're eligible. The other thing is to wear a mask, wear a face covering to reduce the spread of COVID-19. In addition, get tested if you think you have symptoms of COVID-19, and of course, stay home if you're sick. So these public health and their measures are still very important. The most important, though, of all of them is for people who haven't been vaccinated to get vaccinated, and those that have not received a booster and are eligible that they receive a booster.
Thank you. Next question: does the county have the resources to sequence tests to determine if a sample that they have received is the Omicron variant?
That's a good question. We've been conducting whole genomic sequencing now for quite some time here in our public health laboratory. But it's a good question. And even though this is a new variant, we in our public health laboratory can conduct whole genomic sequencing, which means not only should we be able to detect the Omicron variant, but we've been able to detect other variants of concern, such as the West Coast variants, the Delta variant, and many other variants that aren't considered variants of concern or interest that have appeared from time to time throughout the pandemic. So through whole genomic sequencing, we should be able to detect Omicron variants should a sample be collected and sent to us from a person who has COVID.
Thank you. Next question. Have county health officials had discussions with local hospital officials about the Omicron strain? If so, could you summarize what was discussed in regards to the variant?
What I can share is that we, through most of this pandemic, we've been having weekly, sometimes, and weekly meetings with hospital representatives. And this year we've been having meetings twice a week with hospital representatives about COVID-19. And so we've had these meetings during, when we had the West Coast variant, we continue to have the meetings through the Delta variant. And when we do detect Omicron here in Monterey County, we will continue to have these meetings with hospital representatives. The topics in these meetings are basically the hospital's status with regards to COVID patients and the hospital's capacity to care for patients who test positive with COVID.
Thank you. Next question. President Biden is now encouraging Americans to wear masks indoors because of the Omicron variant. Do you anticipate issuing a mask mandate?
I really can say, what I can say is that we are here in public health. We continue to monitor the various metrics that we've been monitoring for over a year now, and in particular, the hospital status. And that's why our meetings with the hospital representatives every week are important, so that we have a good understanding of how they're faring. And we'll have to just continue to work with our hospital representatives and see how things progress. But I think what's really what's really most important is that people who haven't been vaccinated, that they get vaccinated, and people get their boosters. That's really the critical and most important thing that people can do right now to try to slow the spread of the Delta variant that we have now, and also the new variant.
Thank you. Next question. And you touched a little bit on protective and preventative measures earlier, but the question here is, as Christmas and New Year's approach, what action should individuals in Monterey County take to avoid any COVID-19 infections?
Very good question. We know that during the holidays, people are going to want to visit and spend time with individuals outside of their household, people that maybe they haven't seen for a while. Our recommendation is to continue to take measures to prevent the spread of COVID, even when you're with people that you know very well. And that is to, if you're indoors, and everyone's vaccinated, the recommendation from the state is that people could choose to remove their face covering if they know everyone is vaccinated. But I also think it's important for people to use common sense. And if you're in a household with people that you know and friends or family, and they've all been vaccinated, but an individual perhaps is at increased risk of serious illness, they're immune compromised, they've had for example, cancer, and they're undergoing therapy that weakens their immune system, for example. One might consider wearing a face covering indoors in those settings, just to continue to reduce the chance that COVID spreads to someone who's more vulnerable to severe illness and dying from COVID. So, you use good judgment when you're in households, but when you're during the holidays and you're with in indoor public settings, I still highly recommend that all people wear face coverings, regardless of their vaccination status.
Thank you. And then we've just got one more question in, and if there are any other questions for Dr. Moreno, this would be a good time to put them in. This is a follow-up question to the earlier question about sequencing in the public health lab. How many samples does the county sequence in the lab?
That really depends on how many specimens are sent to us from organizations and agencies that are collecting specimens from the public. So it varies, but I think we believe we have that information on our website, and people are interested, go to the website to see how many specimens have been collected in among Monterey County residents, and the total number of variants that have been identified among Monterey County residents.
Thank you, Dr. Moreno. I don't have any additional questions here. I've gone through all of the submitted questions, and there are no additional questions in chat. If there are no more questions, we'll let Dr. Moreno go and move on to our next topics.
All right. Thank you, Mia.
Thank you very much, Dr. Moreno. And now we are very pleased to have two representatives from the Central California Alliance for Health today to talk about their vaccine incentive program. Joining us today are Lilia Chagolla and Linda Gorman, who are going to tell us more about their program and about the Alliance for Health. Good afternoon, ladies.
Good afternoon. Thank you for having us.
Hi.
Thank you for joining us.
Hi, everybody.
Yeah, I will go ahead and tell you a little bit about, I'm the communications director for the Alliance. We are the Medi-Cal provider for Medi-Cal members in Monterey, Merced, and Santa Cruz counties. And we have recently launched an incentive for members to get their COVID vaccine. And so any Medi-Cal member who has their insurance through the Alliance, who receives a single dose of the COVID-19 vaccine between September 1st and February 28th of 2022 will receive a $50 Target gift card. That gift card will either be mailed, depending upon where the member received their vaccine, or, which Lilia can talk more about, members who go to select pop-up vaccine clinics in our counties will get that $50 gift card on the spot. So again, this is a $50 Target gift card. The aim here is for our members to crush COVID, get the facts, get the vaccine, get $50. We have a campaign out there, what flyers for members in English, Spanish, and Hmong. It's also on our website, which is thealliance.health/crush COVID. If you go to our website, you'll find all the information there on how you're eligible for the vaccine, and then also a link to the My Turn page where members can schedule the vaccine at their convenience at a place that's local to them. So all of this vaccine is eligible for members age 5 and up, who again get their single dose of the vaccine. And I'll turn it over to Lilia, who might have anything to add on that.
Thank you, Linda. Hello, everybody. My name is Lilia Chagolla. I'm the Regional Operations Director for Central California Alliance for Health in Santa Cruz and Monterey County. And in regards to some of the point of service delivery of these incentives of this gift card, the Alliance Outreach Program, the Your Health Matters program, plans to attend some of the pop-up clinics or clinics throughout our service area. That's in Monterey or Santa Cruz County and Merced counties. And these are the larger events that are held throughout our different counties. We cannot attend all vaccine clinics or all various clinics that are open today or on a regular basis throughout our counties, but we do try to partner with our county leaders, schools, and various clinics to try to attend as many as we possibly can. And so when members do attend some of those clinics and the Alliance is there during the clinics, we will be able to provide a $50 gift card for every person who is eligible at the point of service after they get their vaccine. So please feel free to share this information to Medi-Cal patients, Medi-Cal members who are Alliance members, and we are happy to provide the gift card to them. At this point, any questions?
Yeah, thank you. I was wanted to make sure that you had gone through everything, and I see that the website for those interested, the website is in chat. Linda put that in. Thank you very much for doing that. Is there anything that you can talk about why some of your members may be hesitant or may not have yet been vaccinated? Many agencies are working to increase vaccine, progress. How have you been assisting your members with this?
Thanks, Maya. That's a great question. One of the things that we've done is initially, when the pandemic started, before the vaccine was available, we did outreach calls to our members to assure that they stay safe, stay home if they're sick, avoid group gatherings, and reach out to their doctors if needed. But now with the vaccine, there's been a lot of misinformation to the community, where some of our members are very afraid to either get sick with the vaccine. There's also cultural barriers, information at the level that our members are able to understand, and sometimes just access to the vaccine. Some of our members, our Medi-Cal members, are not able to get to a clinic or leave work early enough to get to a clinic. So we try to make sure that we collaborate with our partners who are providing these clinics at different hours in the language that our members are receiving them. And these barriers are really just having that conversation, having that one-on-one conversation, and giving them the information and resources and education that the community needs so they can feel better about how to access services. We know that there's clinics out there that are after hours. We know that there's weekend clinics, and we are able to provide information around facts around the COVID vaccine, where previously potentially our members were getting misinformation from either friends or other people out in public. And we try to make sure that if there's any clinical questions, especially with people with conditions, they can reach out to their provider. That's the key thing. If there's clinical medical information that they need specifically to their conditions, talking to their doctor is the best way. Getting information from the community is probably not. So I think just helping our members understand how to access the correct and most accurate information really does help with the community to get vaccinated. And that's been a success so far for the Alliance, and we're happy to always answer any questions our members have. And they can always call us at 1-800-700-3874. That is our member services line. And they can always call to get information on how to access the vaccine, as well as information about their health care.
And to give people an example of the importance of getting this information to members, if you could describe your membership, how many members are we talking about?
Yes, there's quite a few. So across our service area, Santa Cruz, Monterey, and Merced County, we have over 380,000 members. In Monterey County, we have over 160,000 members. That means that in Monterey County, 1 in 3 people are actually our members. In Merced County, 1 in 2. And in Santa Cruz County, 1 in 4 people are our members. So there's quite a large population. And we are, our membership is a low income, underserved populations who the majority are Latino with children. These are more than 50% of our membership is our families. So here you will find that there are families with children in schools, families who are have limited access to resources and services, who are being served by many of our community-based organizations that we partner with across our service area.
And just a quick question about the incentive. Linda described the Target gift card. How long has that been? Is the incentive new, or has it been in place for a few weeks, and how is it going?
It's going really well. The incentive is new. The incentive is actually an incentive that was this incentive program was something that was started by the state of California, and it was an opportunity for managed care plans to apply to this incentive program to increase vaccinations in our service area. So it's new. It started on September 1st, and it will end on February 28th of 2022. And this is really to just increase the vaccinations and encourage members to provide to get vaccinated. It's going well. We so far, because of we've been going out to various outreach, or actually we've been outreaching to various clinics in our service area. We've attended quite a few. We attended some clinics pop-up clinics in partnership with the VIDA program in Monterey County. In King City, we've attended some clinics. Locally, some of our federally qualified health centers, as well as school sponsored events that are partnered with the county. So it's been going well. There is a lot of dialogue and a lot of information and education provided to our members. So in addition for them to get this vaccine and getting the incentive, sometimes they get information that they needed around the health plan to access care. So there's many benefits for our members to be able to go out and get vaccinated.
Thank you very much, Lilia. I don't have any questions, any additional questions here for you. Thank you, Linda and Lilia, for sharing the information about the incentives, and for those who don't know about the work of the Alliance and what they do, just bringing everyone up to speed on that. Thank you both.
Thank you very much.
Right. And now we're very pleased to be joined by Jessica McKillop. She's the Executive Director for the Independent Transportation Network, and she has got some great news about a new affordable senior ride program that is just about there, right? Right, Jessica?
Yes, we're really excited to be starting this program. Sorry, I had to take off my speaker. My
Perfect.
service has been shoddy here at the office, so there shouldn't be any more echo. I apologize about that. Yeah, so Independent Transportation Network Monterey County is getting ready to enter into its 10th year. We've been providing dignified rides for seniors, anyone over the age of 60, and adults with visual impairments throughout the Monterey Peninsula and the greater city of Salinas. And we've just been really blessed as one of the 12 affiliates of ITN America to receive some Federal Transit Administration funding that is allowing us to launch a rural project. So we're targeting South County and north of Salinas. And this is a partnership that we've been grateful to enter into with Alliance on Aging. And so we are currently doing outreach and recruitment, gathering surveys, really wanting to understand where the transportation barriers are when it comes to those who live in smaller communities, and then building a reliable service that will likely be much like our current model, relying upon volunteers to fill in who use their own vehicles, and then have our paid drivers fill in when those ride availability issues arise and we don't have volunteers dedicated to do so. So right now, our project has been really great in recruiting surveys, and we have 2 steering committees. We're looking to launch with the new technology and software in February. Our hope is that the media teams will support this project and get the word out and allow us the opportunity to really ensure that the community knows about the importance of this project.
So I do have a question for you. You talked about volunteer drivers. How will you be doing, how will people find out how they can be a driver? How will that recruitment happen?
Fantastic question. We have a website currently for our service area, and we have been doing both in-person and social media outreach in South County. We have some marketing funding, so we definitely will be looking at some possible radio or TV promotion opportunities there. But oftentimes it is the family members or other community activists in the community who really know that there will be this opportunity. We have recruitment flyers that we've been putting out at coffee shops and things of that nature. And we're currently reaching out to Hartnell College with their South County new campus, that the hope is there might be the opportunity for students to give rides in between class schedules.
Thank you very much for joining us to talk about this. So I'm hoping that we're going to hear more about this. This is supposed to start in Did you say January? I am sorry, I didn't jot that down. Should we be starting will you be starting to promote where people can get these rides? Maybe at the beginning of January?
Yes, our current committees are working on the reasons we'll give rides and if there will be kind of any limitations, obviously, because it's a rural project. We definitely want to make sure it's affordable and realistic and something that we can support well into the future. So most likely we will start with medical and grocery store, as our survey data is really reflected. That's where the larger kind of limitations or challenges are for older adults in those communities. And then we will definitely be able to grow the service. But our goal is to start heavily recruiting for volunteers and getting the word out about the program in January, and then having the new software to launch with rides in February.
Great, thank you. And thank you so much for joining us to share, to kind of give us a preview of what will be coming. I'm sure there are a lot of people in our rural communities that are really going to be looking forward to having the chance to get these rides.
Thank you. Right. It's great to share the information as well. We look forward to it.
Thank you, Jessica. And then we are now happy to be joined by Leanne Magowski. She's the director of our Emergency Communications 911 department, and she is going to tell us a little bit more about the launch of our new user feedback program for 911. And today's the day, Leanne, right?
Good morning, everyone. Yes, Maya, today is the day where we actually have about 31 calls in the queue that will be sent customer service feedback. So for those of you on the call that don't know, it's actually gotten quite a lot of questioning from the media, and I saw it on the news already today. Emergency Communications, that provides 911 services to a majority of Monterey County, has now implemented a new customer service feedback tool. So what that means is if you are on a cell phone, that a certain period of time after that call, you're going to get a short survey that you can answer through a series of text messages. Now, this won't go to every call type, not very sensitive call types, but our regular routine call types. And then our hope is that we are going to get some great customer service feedback to provide to our dispatchers that provide service 24/7, 365. And also, if there's something that we can do to improve, we're going to give the community an opportunity to provide us that feedback through this portal.
It's great that we're already hearing about it today, and there are already calls in the queue. Could you talk a little bit more about the value of the feedback, not just for improvement, but for things that happen that that dispatchers want to know, like feedback for dispatchers, like thank you for helping me. People who are in a crisis, the crisis may be over, and they have no way to say thank you for saving my life or thank you for protecting me.
Yes, thank you for that prompt, Maya. The dispatchers across the country and in the United States, answering emergency calls can be very stressful. Dispatchers are first responders because they are that person on the line making the connection while police, fire, or EMS respond. And one of the things in this job is oftentimes we don't know the outcome of calls. And so, in the real extreme calls, we will get feedback, and sometimes we get the feedback that for improvement, right? But we don't often get that general routine feedback. And one of the things that part of this Q-HIT program is, it actually creates information that we can share with all of the dispatchers. It gives statistics. So for example, when Q-HIT came to us and asked us to be part of this program, the feedback that they've gotten so far is 94% of the surveys that they had done nationwide, customers were actually satisfied with the service that the 911 dispatchers provide. And we were really impressed with that number. And we certainly hope that we have that great success as well, because in this stressful environment, it is nice to hear a thank you and a directed reason for a specific call, because all too often, with 500 on average 911 calls a day and anywhere from 800 to 1,000 admin calls, and these are just the phone calls, they don't always result in a call for service, but the dispatchers of Monterey County are very busy, and it's good for them to hear some feedback.
And so what we really also want to do is really encourage people to go ahead and respond to the survey. It's not a spam survey. It's not, something that will be a problem. Or so to encourage them, what would that text look like? Like, who would it be from, so that people would know it's a legit text to them?
So I believe it's going to say Monterey County. Hold on, I have the technical person right here next to me. I believe it's going to say something to the effect of Monterey County Emergency Communications has a short survey for you to participate. I think it's like press 1 or press 2. Hold on just one second, and I have one. It's actually going to say, this is the Monterey County 911 Center. Based on your recent call, please take a minute to answer a few questions. How satisfied are you with the way the 911 call taker handled your call? Please respond with a number 5 very satisfied, 1 very unsatisfied. And then we have a prompt for Spanish as well. And then basically, based on what you answer, it'll give you a few more questions. It's a very short survey. And then if you want to give more feedback, we're going to provide you an email so that you can email your information. The really important part is, if you choose to email us, please put the phone number in associated that we texted you so that we can trace you back to your original call.
And we want to encourage people that if you get that survey text, answer it. You know, help 911 do what they do.
Yes, and this is the first day, so we're rolling feedback out. There is a timing sense, so it's not immediate. It's not like a right away. We do want to give people some time, and we also understand sometimes when that survey comes in, you don't want to answer it immediately, but think about it and go back to it when you do have time, and please answer it. We certainly would appreciate it.
Thank you very much, Leanne. That's all the questions that I've got. Unless there are any additional questions, that will wrap up our media call for today. Thanks everyone for taking part. Our next media briefing will be next week. We'll see you then.